Hey there, Jennifer Bell here, Colorado State Licensed Insurance Agent, here to talk to you about Medicare. Now, with all the alphabet soup of Medicare, it can definitely be confusing, but not to worry, that's where I come into play. So today what we're going to do is we're going to talk about Medicare Part B. That's right, B as in boy. Medicare Part B is the part of Medicare that actually has a monthly premium. And a lot of people will have that premium come out of their Social Security check, if on Social Security, or pay it cash, or I should say check, really. So Medicare will send you a bill if you're not taking Social Security income, and generally speaking, they're going to bill you on a quarterly basis. But Medicare does say that there's 4 options for paying them. 1 is to pay that invoice, 2 is to pay with a credit card, 3 is to do Medicare Easy Pay, where they just deduct it from your checking account every month, and 4 is to set up an automatic bill pay from your bank, and your bank sends a check every month. Now, Medicare Part B is going to be the part of Medicare that honestly, you're probably going to use the most. Part A covers the hospital stay, and quite honestly, most people aren't in the hospital very often. But most people do see their doctor once a year, maybe 2 or 3 times a year. We go to the doctor if we have the flu or a cold. If we go to the emergency room, we need Part B. Part B is really your day-to-day. So Part B is going to cover doctor visits, outpatient surgeries, emergency rooms, chemotherapy, radiation, any infusion centers where you have infusion medications. It's also going to cover durable medical equipment, so wheelchairs, walkers, oxygen. It really is our day-to-day run-of-the-mill insurance. So it's definitely worth paying the premium. One thing to think about is delaying Part B. Now, if you have an employer group plan where you're working actively, you or your spouse, and you're covered under an employer group plan, you can delay Part B without being penalized. However, if you don't have any other insurance that counts as credible coverage in the eyes of Medicare, then you will be penalized at a later date when you join Medicare later. So what I mean by that is when you turn 65, you are eligible for Medicare. That is the time when you could and should sign up for Medicare. The only thing that would save you from having to sign up for Medicare is employer group coverage. Now, even the VA does not count as credible coverage in the eyes of Medicare for Part B. So if you just take your VA insurance and don't take Medicare at all, but then later on decide that you probably should have Medicare, you will get penalized on the monthly premium for Medicare Part B for the rest of your life. It's kind of a nasty penalty. I always recommend picking up Part A and Part B when you could and should. Now, when you use Medicare Part B, there's a few things to the cost that you have to keep in mind. Medicare Part B has an annual deductible. This annual deductible is pretty manageable at the moment. In 2019, it's $185 for the whole year, and it resets every January. Now, Medicare is governed by the government, and so these deductibles and copays that we talk about, they're moving targets, which means every January, these numbers could change. So for the year 2019, the deductible for Part B is $185. Once you've met your deductible, if you just have Medicare, nothing else, then you're looking at that about 80 to 20 split. What I mean by that is Medicare is going to cover about 80%, and then you'll be left with about 20%. So just keep that in mind. One of the things that I found out when I first became an insurance agent and never realized that this was even possible was Medicare does not place a maximum annual out-of-pocket on any of its services, not in Part A and not in Part B. So if you are just sitting on Medicare by itself, no other insurance protection in place, just know sky's the limit. Medicare isn't going to cap out the number of dollars that you put out of pocket in a 1-year period. You've probably been used to that in your previous insurance plans when you were working, but unfortunately that's not how Medicare works. And that's really where these additional insurance plans come in handy, just to give you some added protection against the massive out-of-pocket expenses that could potentially be incurred if you had something serious happen. Now, I did talk about Medicare Part B having a monthly premium. The average monthly premium for the year 2019 is $135.50. Now that can change. So if your income is below a certain limit for your state, your county, whatever area you're in, Medicaid can come in and help pay your Medicare Part B premium. Now, just a real quick differentiation, Medicare is what everyone's entitled to when they turn 65. Medicaid, on the other hand, is aid. That's how I remember it. Care is everyone, Medicaid is aid for people who have financial limitations. So if your income is a little bit lower, then you can qualify for assistance through Medicaid. So the Part B premium can be different for folks, either based on a lower income or even a higher income. And there is a chart on Medicare.gov. If you search Part B premiums on Medicare.gov, it'll pull up a chart. And the chart tells you what income bracket you're in, if you file taxes as an individual or you file jointly, and then it will tell you what your monthly premium will be. Something to note is that that income is based on 2 years back. So we're in the year 2019. The most recent tax return that has been completed for sure is 2017. So Medicare is going to look at your income from 2017 and they're going to base your 2019 monthly premium on that income. Keep that in mind. Some people will be working and making a pretty decent income, like really high, and then they'll retire and 2 years later their income comes down. So keep in mind that that chart, you could also lower your Medicare premium over time. You just have to make sure that you're pointing it out to Medicare once you have a 2-year look back and your income falls into another category. I'm not quite sure if Medicare adjusts that on their own, but I would definitely remember that so that 2 years later you can be adjusting your premium. Now, when it comes to additional insurance for Medicare, you have a couple of options, but you do need to have both Part A and Part B in place to get any other health coverage that goes with Medicare. One exception to this rule could be that when you're working. So if you're working and your employer does not require you to go on Medicare, then you don't have to. But if you have an employer who has less than 20 employees, technically Medicare would be the primary payer and your employer coverage would be secondary. So you definitely want to make sure that you do or don't have to take Medicare based on your employer. And then if your employer requires you to go on Medicare and has less than 20 employees, Medicare will pay first, and so you will need both Part A and B. Thank you so much for watching this video. Please share it with your friends and family. I'm happy to help answer any questions. You can email me. I hope you have a wonderful day, and we'll see you on the next video.